Jammu and Kashmir Democratic Freedom Party has drawn the attention of Hissam Braham Taha, the Secretary General of Organization of Islamic Cooperation, towards the plight of Kashmiri political and human rights activists languishing in Indian jails for their political beliefs and commitment to human rights. According to Kashmir Media Service, the DFP, through a letter written by its acting chairman Mahmood Ahmad Sagar, mentioned arbitrary arrests, prolonged detentions, and custodial torture as key tools for repression by the Indian regime. The letter deplored that Indian forces operate with impunity under draconian laws like the Unlawful Activities Prevention Act and the Armed Forces Special Power Act. These laws have created a culture of fear, with civilians subjected to daily harassment in streets, marketplaces, and even their homes, violating their fundamental rights to life, liberty, and privacy in the occupied territory. Thousands of Kashmiri leaders, journalists, and activists arrested before and after August 5, 2019 continued to languish in jails under inhuman conditions, and the letter added Kashmiri prisoners, including prominent figures like APHC Chairman Masarat Alam Bhatt, Shabir Ahmed Shah, Mohammad Yasin Malik, Naeem Ahmed Khan, Asian Drabi, and Khurram Parvez, mostly imprisoned at India's notorious Tihar jail, are suffering from severe health issues due to prolonged detentions. Women activists detained in Tihar jail have reportedly physical and psychological abuse, further highlighting the systematic mistreatment of Kashmiri detainees. The letter said and urged international human rights organizations to intervene and hold India accountable for its actions in the occupied territory. In addition to that, around 2 million people out of 12 million population in Kashmir are battling heroin addiction, a crisis largely attributed to India's brutal occupation of the territory. According to Kashmir Media Service, a report by Al Jazeera has highlighted the devastating impact of drug addiction on the youth in occupied Jammu and Kashmir, surpassing even Indian Punjab. Notably, Sikh and Kashmiri intellectuals consider the rising addiction a deliberate strategy by India to weaken the ongoing freedom struggles in these regions. The Al Jazeera report states, in August 2023, an Indian Parliament report estimated that nearly 1.35 million of Kashmir's 12 million people were drug users. The report also shared the ordeal of 24-year-old Kashmiri girls struggling with drug addiction as an example of the worsening crisis. Key experts from the report go on as Afia's frail fingers pick at those threads of her worn dark brown sweater as these sits at the edge of her bed in the rehabilitation ward of the Sri Maharaja Hari Singh Hospital in Indian administrated Kashmir's main city of Srinagar. With faded and stained clothes hanging loosely on her thin frame eyes, downcast, she says, I used to dream of flying high above the mountains, touching the blue sky as a flight attendant. Now I'm stuck in a nightmare, high on drugs, fighting for my life. Afia, 24, is only one among thousands of people addicted to heroin in the disputed territory of Indian illegally occupied Jammu and Kashmir, where a growing epidemic of drug addiction is consuming young lives. A study by the Psychiatry Department of the Government Medical College in Srinagar found that Kashmir had overtaken Punjab, the northwestern Indian state battling a drug crisis for decades, in the number of cases of narcotics used per capita. In August 2023, an Indian Parliament report estimated that nearly 1.35 million of Kashmir's 12 million people were drug users, suggesting a sharp rise from nearly 350,000 such users in the previous year, as estimated in a survey by the Institute of Mental Health and Neurosciences at the Government Medical College, Srinagar. The survey also found that 90% of drug users in Kashmir were aged between 17 to 33. SMHS, the hospital Afia is in, attended to more than 41,000 drug-related patients in 2020.